Welcome to our interprofessional education presentation. We'll be discussing how physical therapists, speech-language pathologists, and occupational therapists can work together. This presentation will be done by Gabby Morano, Kyle Fensky, Andrea Sprague, and Colin Bales.
So, beginning with physical therapy, physical therapists can be known as movement experts, and the APTA vision statement is transforming society by optimizing movement to improve the human experience. And the APTA mission statement is building a community that advances the profession of physical therapy to improve the health of society. Physical therapy is services provided by physical therapists to individuals and populations to develop, maintain, and restore maximum movement and functional ability throughout the lifespan. The service is provided in circumstances where movement and function are threatened by aging, injury, pain, diseases, disorders, conditions, and/or environmental factors, and with the understanding that functional movement is central to what it means to be healthy. Physical therapy involves the interaction between the physical therapist, patients, and clients, other health professionals, including occupational therapy and speech-language pathology, the patient's families, caregivers, as well as the community. Physical therapists are concerned with identifying and maximizing quality of life and movement potential with promotion, prevention, treatment, intervention, and rehabilitation. These encompass physical, psychological, emotional, and social well-being.
Physical therapists have many roles and responsibilities, including performing a comprehensive subjective and objective exam of the patient or client, using your exam findings to evaluate and make clinical judgments, formulate a diagnosis, prognosis, and plan, provide consultation with your patient if they need to be referred to another healthcare professional, collaborating with the patient to implement interventions, come up with home exercise programs, and provide education, evaluate and reevaluate your objective findings and outcome measures, make recommendations for self-management, and collaborate with other healthcare professionals and stakeholders, including insurance companies. Physical therapists undergo typically a 3-year program to become doctors of physical therapy from the Commission on Accreditation in Physical Therapy Education. And their primary content areas include biology and anatomy, physiology, exercise physiology, biomechanics, kinesiology, and neuroscience, as well as many other areas. They must pass a national physical therapy exam at the end of their schooling, and their licensure is managed by each state. It can be found in many settings, including, but also not limited to, outpatient, acute care, the school systems, transitional care units, skilled nursing facilities, inpatient rehab facilities, sports facilities, and workplaces. And job outlook is looking very good for physical therapy, as it's projected to grow 18% by 2029.
Okay, so what's occupational therapy and how is that different from physical therapy? Occupational therapy helps people across the lifespan to do the things that they want and need to do through the therapeutic use of daily activities, otherwise known as occupations. Occupations are activities of daily living, or ADLs, instrumental activities of daily living, or IADLs, rest and sleep, education, work, play, leisure, social participation, and health management. So, what are specific examples of these occupations and why are they important? So, for ADLs, those are bathing, showering, dressing, eating and swallowing, feeding, toileting, and personal hygiene routines. IADLs are child rearing, care of pets, driving and community mobility, financial management, meal prep and cleanup, and shopping. Rest and sleep involve sleep preparations, doing specific routines, grooming, dressing, brushing your teeth, and participation. So being able to sleep all through the night. Education includes participating in academic, so math, reading, any sorts of school classes, non-academic, so recess, lunch, extracurricular, sports, clubs, etc., technological, so distance learning, and vocational educational activities. For work, choosing work that aligns with a person's interests and abilities, applying for those jobs, preparing for interviews, being an effective and productive employee, preparing for retirement, and participating in volunteer work. For play, there's play exploration and participation. So play exploration includes pretend play, games with rules, constructive play, and symbolic play. For leisure, there's planning and participating in selected leisure activities, and also just defining what your favorite leisure activities are. For social participation, that is being social in the community, with family, with friends, intimate partners, and peer groups. And for health management, managing physical, mental health needs, communicating with the healthcare system, managing your medication, getting your physical activity, having proper nutrition, and also managing your personal care devices. So this is a quote by a prominent member of the OT world, Florence Clark, and it says, "Occupational therapy practitioners help people live life to its fullest no matter what. They provide practical solutions for success in everyday living and help people alter how they arrange their daily activities to maximize function, vitality, and productivity." So what underlies occupation? This is what occupational therapists kind of define, really, and they get this through the occupational therapy profile that they get kind of when they first evaluate a client. So they identify what the context that person is living in. So whether it be environmental, what does their house look like, or personal, what kind of supports do they have? Do they have family? Do they have friends that check in on them? They defined their performance patterns. So what kind of habits, routines, roles, and rituals do they already have? And how can we use those to help treat the client? Performance skills, identifying motor process and social interaction skills that usually kind of get in the way to have the ability to perform certain occupations. And client factors, so values, beliefs, spirituality, body functions, and body structures. So how do you become an OT? You have to get a bachelor's degree. You can get any degree as long as the specific prereqs are met. And then that mixed with shadowing and volunteer experience will get you to be able to apply to a master's or doctorate program where you'll get fieldwork experience, and it would last about 2 to 3 years. And then eventually you will sit for the National Board for Certification in Occupational Therapy exam. Where can occupational therapists work? So they can work in schools, hospitals, rehab facilities, assisted living facilities, home health, community centers, prisons, mental health facilities, or just common workplaces where they're hired as ergonomic specialists. And since OT is so broad, it can be confusing to kind of figure out what they do, but the focus is on occupation. So for this picture here, it looks like an individual is adapting to using a prosthesis. So PT might be working with them to help get muscle integrity, like through squats or whatever else it may be, but OT will be more so focusing on if they can ambulate throughout their kitchen, throughout their house, and perform tasks like cooking, cleaning, getting clothes on, that sort of thing. And then job outlook, a quote from U.S. Bureau of Labor Statistics: employment of occupational therapists is projected to grow 16% from 2019 to 2029, much faster than average for all occupations. And here is a group picture of the year ones and twos from UMary Fargo campus. We look like a happy bunch, and we may be coming from the same program, but we have interests in a variety of different areas. So.
Moving on to the field of speech-language pathology, the field began with educators and professionals who were interested in learning more about people who had speech problems and helping to fix their issues. They became known as speech doctors. From 1918 to 1939, the National Society for the Study and Correction of Speech Disorders was a group comprised of school teachers turned what was then called speech correctionists. This group worked together across the country to help grow the field. In 1925, what is today known as the American Speech Language Hearing Association was established. It was then known as the American Academy of Speech Correction. It began as 25 members, and they are now today the leading professional organization of the field of SLPs, known as ASHA. The scope of practice for an SLP, it is defined as the professional who engages in professional practice in the areas of communication and swallowing across the lifespan. Communication is defined as speech production in fluency, language, cognition, voice, resonance, and hearing. And swallowing is defined as all aspects of swallowing, including related feeding behaviors. The service delivery areas. SLPs work with a variety of clients and see a variety of disorders. Some areas that they might work on include, but are not limited to, fluency, which would work on an individual who may have stuttering issues or cluttering. Speech production, in which they may work with adults or children who have motor speech disorders or children who have articulation or phonological disorders. Language, which targets literacy, pragmatics, or any type of language delay. Cognition, in which a client may have difficulties with memory or executive functioning. With voice, a clinician may work on transgender voice therapy or helping to fix someone's voice after they develop a voice disorder. Resonance may include fixing hyper or hyponasality that may follow a cleft palate repair. Feeding and swallowing helps to work on an individual's swallowing and feeding abilities. Auditory habilitation and rehabilitation work on developing speech listening abilities following hearing loss. And a final area is augmentative and alternative communication, which helps provide individuals who don't have a way of communicating an alternative way to communicate other than their voice. The settings that an SLP might work in include healthcare, which could be in acute care, inpatient rehabilitation, long-term care, outpatient clinics, or pediatric hospitals, private practice, or a school. Within these settings, an SLP will serve clients from birth to death. They see a variety of disorder types and a variety of causes of these disorders. The education and certification to become an SLP. First, a future SLP needs to earn a bachelor's degree in communication sciences and disorders. Following that degree, they will earn a master's degree in speech-language pathology. After the completion of their program, they will complete the praxis examination. Then they will apply for a clinical fellowship year, which includes 36 weeks of clinicals, or 1,260 hours. Following these steps, an individual is able to apply for certification through ASHA and receive their certificate of clinical competence. According to ASHA, the job outlook for SLPs is very good. Job opportunities are expected to grow by 25% from 2019 to 2029. There are currently 181,629 ASHA certified SLPs, and there are expected to become 40,500 more jobs available in the next 10 years.
So what is an interdisciplinary team and why are they important? A rehabilitation therapy team is comprised of physical therapy, occupational therapy, and speech language pathology. They work together to provide care to patients whose lives have been affected by disease, injury, or disability, and they help to address impairments in the patient's ability to move, speak, eat, walk, dress themselves, and otherwise participate in their normal daily lives.
We just heard how all the disciplines were different and what made them unique, but they're also very similar to each other in the fact that they follow a similar trajectory of treatment from initial evaluation to your daily, weekly, and other progress notes, and then ultimately ending in discharge. We focus on caregiver training to help support the patient with their goals, and we provide somewhat similar treatments as we all focus on functioning and getting the person moving in the real world. And you can also find us all in similar settings, including acute care, inpatient rehab, skilled nursing facilities, schools, or outpatient settings as well.
Okay, so how can we work together? So let's say we're all working with an individual who's just suffered from a stroke. As an occupational therapist, I will get an idea of what their daily roles look like. Are they a parent? Do they have animals that they care for? Do they have supports? Do they have family? All of those things. And then based on some evals, I'll be able to figure out if this individual can still cook meals for his daughter, dress himself, those sorts of things. And then I'll provide coaching, exercises, and adaptive equipment to help.
As a physical therapist, we're more worried about gross function of the patient. So this is bed mobility, transferring out of bed and getting down the hallway. So in the same instance that OT was talking about, can he even get down the hallway to the kitchen to cook for his daughter? If not, we will provide exercises, different types of training, possibly assisted devices, and get them to be able to function in their daily life.
As a speech language pathologist, I'm going to look at this patient also from a functional standpoint, but looking specifically at his communication and swallowing. I will also consider his cognition. So things I may look at is the patient able to speak to his wife or other family members without struggling to find the right words? And is he able to move his jaw, mouth, and tongue in order to speak the words that he's trying to come up with? If he's having trouble with this, I might work with him to improve his ability to communicate and recommend other ways that he could communicate, such as using an AAC device. I'm also going to look at his swallowing and make sure that he is safely swallowing and able to continue eating and drinking foods as he did before. And here are our resources.
So we are going to do a presentation on an individual, like we had mentioned in the PowerPoint, who has just suffered from a left CVA. And we'll be doing different kind of quick interventions, and then we'll also show you how we would communicate in passing in a hospital-like setting.
My main concern right away as an SLP is making sure that there are no issues with his swallowing. That's a large concern as far as his safety. So I'm going to make sure to assess his swallowing and just do a minor assessment and see where his language skills are at.
From a PT standpoint, on the first initial eval, I'd probably come in and just kind of assess how the patient's able to move around, check his bed mobility, and see if we can get him to the edge of the bed and kind of check how his balance is at the edge of the bed first, and then possibly ambulation with an assistive device, and also check lower extremity strength.
As an OT, I will definitely want to hear Kyle's eval reports so that I would know if I should also test like upper mobility and upper body mobility, and also if he's getting out of bed, then I'll be able to kind of do self-care tasks in the bathroom. Otherwise, I will be in there gathering an occupational profile, getting an idea of what he does day to day and how those occupations can shape my intervention.
All right, Colin, how are you doing today?
Good.
You feeling good? I'm going to go ahead and check and see your swallow and see if your stroke had any impact on your ability to swallow normally. So I just have this glass of water for you, and I just want you to take a sip like you normally would. Good. Can you go ah for me?
Ah.
Very good. Did that feel like it went down okay? You don't feel like you choked on any of it?
Yeah.
Hey, did you work with Colin yet?
Yeah, I was actually just in there. It looks like he's doing pretty good post-stroke. It looked like he had a little bit of weakness on his right side. He was only able to use his left side. I was taking a look at his swallowing.
Does he have any problems with speech or anything?
Yeah, it doesn't seem like he has much language. I think he has having a lot of hard time finding the right words. So I'll go ahead and send you with a communication, just a simple communication board that you can use with him today. So hopefully he's able to communicate with you okay.
All right, sounds good. Thanks. Hey, Colin. How are you feeling? Good. I'm Kyle. I'm a student physical therapist. I'm going to be working with you today. First, we're just going to kind of see how you're moving around in bed a little bit. So, do you think you can reach over with this arm and try to get seated at the edge of the bed? Reach over with this arm. Okay. All right, I can help you. You grab my hand. push through this elbow. Good job. I'm gonna get you a gait belt. Are you comfortable right there? Yes. Is that too tight? No. Now pretty soon we're gonna see how you can like get up and walk, but I'm just gonna do a quick assessment of your leg strength, okay? So can I have you kick out this leg into my hand? Don't let me move you. And relax. Can you do the same thing on this one?
Hi Kyle.
Hi.
How are you today?
Good, how are you?
Did you happen to just come out of Colin's room?
I did. So he did okay, has some trouble speaking, just as Andrew was saying earlier. Right-sided hemiparesis. I just tested bed mobility. He was able to get to the edge of the bed, but not balanced, not great.
Okay.
And we weren't able to see how he was walking just because that right lower extremity is really weak, can't really extend at the knee.
Okay.
So
Sounds good. Thanks, Kyle. Hi, Colin. Hi, Mrs. Bales. How are you guys today?
Good. How are you?
I'm good. So I'm going to ask you a couple questions. Colin, I understand that you're having a little difficulty communicating today. Is that true? Is it okay if I ask her some questions about your day-to-day living so I can get a good idea of what's important to you?
yes.
Okay, awesome. So, do you guys have any children?
We have two.
2 kids. Are they out of the house? In the house?
They're out of the house. They're in college.
Okay, awesome. So, what does Colin's everyday life look like? Does he dress himself in the morning?
Yes, he usually does.
Yeah? What kind of clothes does he likes to wear?
Usually he wears dress clothes on his work as he goes to work.
Oh, yeah, awesome. Let's see. What else would you want to tell me about Colin that seems important to you? What kind of hobbies does he like?
He really enjoys reading and going for walks, and he also enjoys cooking in the kitchen. He likes to cook a lot.
What does Colin do for work?
He works as an accountant.
Okay, cool. Awesome. So with this information, I'm going to come up with some interventions that will be shaped to help you recover, but we'll also kind of focus on those cooking skills. We'll talk about how you can return back to your work, and we'll just go from there. How does that sound?
Good.
Awesome. Guys, I just saw Colin. Do you guys want to kind of talk about what you're thinking for goals for him?
Yeah, that sounds great.
Awesome. So my goals are just to be able to get him up, doing his self-cares, brushing his teeth, etc. It looks like he's a wife, so that's really good. And yeah, so those are my main short-term goals right now.
Perfect. Yeah, from a PT standpoint, we just want to make sure he's able to walk around his house safely. We might have to send him home with a assistive device like a walker, but I want to make sure that he can walk around like 300 feet.
Mm-hmm. That would be important for me too, so he can go to the bathroom, to toilet, and brush his teeth as well.
Right.
Yeah. I'm really just focused on his speech and communication right now. His swallowing, based on my bedside swallow exam, appears to be totally normal. So I just really want to focus on that speech, allowing him to communicate with his wife and kids, and if possible, I'll provide him with a device that he can take home with him so that he can keep communicating and working on that as he goes.
Awesome, sounds good, guys.